It's a report from Cancer Research Center, Children Institute. So, prognostic significance of MRD in children BLL at post-induction period. Mary Shervashidze will make a report, and co-author is head of oncohematology department in children, Professor Valiev. He is here. So, as well as Alexandra Paladina, she was made a report just previously. So, please.
Dear colleagues, I'm glad to see you in this wonderful conference. Many thanks for Professor Tupitsyn. It's best invitation in this year. Let me introduce you our experience about post-induction MRD. Sorry. What could we say about MRD? Role measuring minimal residual disease in the treatment acute lymphomyelitic leukemia is great. We use MRD levels as a tool for the significant, and treatment optimization has become a basic modern OLL treatment therapy. All protocols, all people, all ward program. For oncologists, clinicists, and psychologists, MRD is a base of risk-tailored combination chemotherapy. First of all, we have MRD in an induction, and we start our risk stratification therapy based on MRD level. We use MRD on before transplantation bone marrow, and we have best time point for transplantation, and we have information about use monoclonal antibody and best time to use this drug, and we know about these two important points. But what about post-induction therapy? It's very interesting question, and all our colleagues in the ward research about this question. We have many times ago then we use MRD level and MRD determination, but in the post-induction, they have some problems and some interesting results. New methods and new technology for measuring MRD give us a new idea in our strategy. We have some new information, and we have no idea to improve survival and quality of life our little patients. Modern ideas about significance of MRD levels during the post-induction, it's maybe prognostic point for early relapse or prognostic point for new sense to transplantation, but it need to study. What about our experience? In our clinic, I need to say the long years work in collaboration with BFM group. It's a good partnership, and we work in ALIC BFM protocols. In our study, all patients included in ALIC BFM 2009 protocols. You could see median age and male and female. In our group, we have 135 children in BOLL who include in our study, and we see some interesting results. This our protocol, what we used. It's very interesting and very complicated, like our protocols. All patient in our protocols stratification in risk group by MRD on the 15 or 33 days. And now in BFM 2009, we use post-induction point. It's 78 days. We have strong response criteria. MRD negative status, it's 0.01% and less, and MRD positive status, it's more, 0.01%. We evaluate complete cytology remission, and we have next result. In this slide, you can see like evaluation MRD on different time point. We see what on day 15, MRD negative status was noted only in 30% on patient. On day 78, we have MRD negative status on 50% of patients. Dynamic reduction tumors clone say us they choose a right therapy strategy. If we have a rapid increase MRD level on the 78 day, we think about this group patient need to increase our treatment. Maybe use a monoclonal antibody, maybe use a high-risk treatment, or maybe use early transplantation. When we analyze statistic result, they have next point. For overall survivor, we not big difference between MRD negative or MRD positive, but we have very different result between MRD positive patient. It's about 66% disease-free survival, and MRD negative patient, it's about 88% disease-free survival, and such result for event-free survival. What do you think about this result? We have found a relationship between MRD status on day 78 post-induction and the frequency of relapses. Although at the moment there are no reliable data on the effect of post-induction, but have strong tendency, and we think about this point may be very important to the future treatment protocols. And what we have? Not two, three important points to MRD status. We have 1 point, it's induction. We have 2 points, it's post-induction, like early predictor of bone marrow transplantant, or like target point for use antibody, or for have a GIPR high-risk group who need more intensive therapy. And we have 3 points, it's time before transplantation, when we can use MRD like level 2 best time to transplantation. Our research are continuous. We have new material, we have new technology, thanks to our immunology group. Its leader is Professor Tupitsin. And I think its future, it's one of the new protocols to point of based post-induction MRD therapy. Thank you very much.